Why health insurance fails Americans. Health insurance in the United States was created to protect people from expensive medical bills and help them receive proper health care. In theory, it should provide security, peace of mind, and access to treatment when people need it most. However, for millions of Americans, the reality is very different. Despite paying high monthly premiums, deductibles, and taxes, many citizens still struggle to afford health care. Some avoid going to the doctor because of cost, while others fall into debt after a medical emergency. The American healthcare system is often considered one of the most advanced in the world, yet it remains one of the most expensive and unequal systems globally. One of the biggest reasons health insurance fails Americans is the extremely high cost of health care. In the United States, even a simple hospital visit can cost thousands of dollars. Ambulance rides, surgeries, prescription medicines, and emergency treatments are often far more expensive than in other developed countries. Insurance companies claim to reduce these costs, but patients still end up paying large amounts from their own pockets. Many insurance plans include high deductibles, meaning people must spend thousands before insurance starts helping. As a result, families who thought they were protected often face financial stress during medical emergencies. Another major problem is the complexity of the insurance system. The average American struggles to understand terms like deductibles, co-payments, out-of-pocket maximums, provider networks, and prior authorizations. Insurance policies are filled with complicated rules and conditions. Many people only realize what is covered after they receive a massive medical bill. A patient may go to a hospital believing everything is covered, only to discover later that a doctor was out of network, causing unexpected charges. This confusion creates frustration, fear, and mistrust among citizens. Employment-based insurance is another weak point in the American system. Most Americans receive health insurance through their employers. While this may seem convenient, it creates serious problems. If someone loses their job, they may also lose their health insurance. During economic crises or layoffs, families can suddenly become uninsured exactly when they need health care the most. This system also limits worker freedom because many employees stay in jobs they dislike simply to keep medical coverage for themselves or their families. Health care becomes tied to employment instead of being treated as a basic human need. Insurance companies also focus heavily on profit. Many large health insurance corporations earn billions of dollars every year. Critics argue that these companies prioritize financial gain over patient care. Insurance providers often deny claims, delay approvals, or refuse treatments they consider too expensive. Patients may spend weeks fighting for approval for important medicines or surgeries. In some cases, people become sicker while waiting for insurance decisions. Doctors and hospitals also spend enormous amounts of time dealing with insurance paperwork instead of focusing completely on patient treatment. Prescription drug prices are another reason many Americans feel failed by the system. Medicines in the United States are often far more expensive than in countries with stronger government regulation. Even insured patients sometimes cannot afford life-saving drugs such as insulin. Pharmaceutical companies, insurance corporations, and middlemen contribute to rising costs. Many citizens are forced to choose between buying medicine and paying for food, rent, or education. This situation highlights the deep inequality within the healthcare system. Mental health coverage is also insufficient for many Americans. Anxiety, depression, stress, and other mental health problems have increased significantly in recent years. However, access to affordable mental health care remains limited. Therapy sessions are expensive, psychiatric care may not be fully covered, and many regions lack mental health professionals. Young people, students, and workers often struggle silently because treatment costs too much. A healthcare system that ignores mental health cannot fully support society. The gap between rich and poor further exposes the failures of health insurance in America. Wealthy citizens can afford premium insurance plans and high-quality private hospitals. Meanwhile, low-income families often depend on limited government programs or weak insurance plans with fewer benefits. Rural communities also face major healthcare shortages. Many small towns lack hospitals, specialists, or emergency facilities. As a result, healthcare access depends heavily on income, location, and social status rather than equal human rights. Medical debt has become one of the biggest financial problems in the United States. Millions of Americans owe money because of hospital bills and treatment expenses. Some people lose their savings, homes, or credit scores after serious illnesses. Even insured individuals can end up in debt due to uncovered services and high deductibles. Fear of debt causes many citizens to delay treatment, making health problems worse over time. Preventive care becomes less common because people worry more about cost than health. Compared to many developed countries, the United States spends far more money on healthcare but often achieves weaker outcomes. Nations with universal healthcare systems generally provide broader access at lower costs. In countries like Canada, the United Kingdom, and several European nations, citizens usually do not fear bankruptcy after visiting a hospital. While no healthcare system is perfect, many Americans question why the richest country in the world still struggles to provide affordable healthcare for all. Technology and medical innovation in America are world-class, but they do not benefit everyone equally. Advanced treatments and modern hospitals exist, yet millions remain unable to access them because of insurance barriers. The system creates a contradiction where healthcare quality can be excellent for some people but financially devastating for others. Healthcare becomes a privilege rather than a guarantee. To improve the system, experts suggest several reforms. Some support universal health care funded by taxes, while others propose stronger government regulation of insurance companies and drug prices. Expanding public health care programs, improving transparency, reducing administrative costs, and protecting patients from surprise bills could also help. Many believe health care should focus more on prevention and public health rather than corporate profit. In conclusion, health insurance fails many Americans because it is expensive, confusing, profit-driven, and unequal. Instead of providing security, it often creates and financial hardship. Millions of people remain trapped between rising medical costs and limited coverage. While the United States leads the world in medical innovation, its healthcare system continues to leave many citizens vulnerable. Until affordability, accessibility, and fairness become priorities, the struggle with health insurance will remain one of America's biggest social and economic challenges.